Hi, everyone. My name is Brian Leaf, and I'm the Community Engagement Coordinator with SCR. Co-presenting with me is Debbie Montenegro, our Consumer Health Coordinator. Many of you may already be familiar with us. Since 2016, we've had numerous speakers discuss topics from disseminating research to disaster preparedness. The region we serve is made up of many different types of organizations, and as we've gotten to hear from experts, we wanted to highlight and reflect on the question of how can we improve the health of our communities as medical librarians, public health practitioners, or other professionals who serve the public. I think we've been in a really unique position to try to think about how to connect people in the network who at first seem to serve unrelated functions. SCR CONNECTions is intended for the larger region, but has been a great way for us to learn and brainstorm. And as we begin year 3, we curated a few presentations or segments of presentations that we think have been especially insightful and that have helped us see the larger picture of healthcare and have also helped to support you all in developing programming and figuring out innovative ways to partner in order to ultimately improve the health of our communities. I agreed to host this sort of best of clip show because as a former instructional designer, I know that we only truly learn when we're able to revisit and reinforce things that we've learned about in the past. And we hope that even though you've seen a couple of these before, this is a chance to revisit and come away with new insights of your own as well. At the beginning of each segment, we'll present some of our own observations along with a question that we'd like you to think about. And throughout the presentation, as you watch each clip, we encourage you to respond directly to the presentation with an answer to that particular question in the chat box or whatever thoughts you may have. So we hope that this will be a very interactive webinar. And we'll also continue with our traditional format by having a Q&A at the end and to revisit any of the comments that you might have made in the chat box. So here we just have a list of the speakers that we'll be featuring today. Moving on to the next slide. Okay, so starting in the fall, we began a new webinar series in partnership with the Patient Safety Institute. And you may have seen ads go out for that over our listserv. But we first introduced the topic in 2016 when we heard from Thomas Stashelski, Director of Patient Safety Education and the Clinical Learning Environment Review Program for the Graduate Medical Education Consortium at Washington University and St. Louis Barnes Jewish Hospital. In this segment, that we're about to show, he defines and justifies the importance of considering patient safety. While it may seem inherent given that physicians aren't trying to do harm, as he says, quote, medicine doesn't plan for error, unquote, and humans are prone to error. I really like patient safety. I think it really sets the stage for a lot of the things that we do and for this webinar. There's a statistic that comes out of the World Health Organization that I often use in my classes to build the case for health literacy, and that is error is routine during the delivery of healthcare and occurs in about 10% of hospital admissions. In the proportion of cases, the harm produced is serious, even fatal. Debbie?
Yes, good morning, everyone. So I just wanted to input some of my thoughts. For patient safety, listening to the speaker, it was very interesting for me to, and you'll see in a little bit, how he talks about how the system currently expects perfection from all doctors who are essentially human beings and who are bound to make mistakes. And since we can't change human nature, there's something else that has to shift, and that could be the system. We can change the system in which humans work, and systems can learn from events to create that change. And so while listening to this segment, I was trying to think about opportunities for partnership for librarians and for other organizations moving forward, and how we can help move towards a realistic and evidence-based culture. And some of those ideas that were running through my mind was, taking part in initiatives, providing literature searches for EBM, which is evidence-based medicine, and those other types of ways that we can assist.
So again, please think about this question that we've presented here and respond with any other thoughts we have in the chat box. And without further ado, we'll go ahead and play the video. Sorry, I didn't realize that I was not quite, that I was still muted. So, great presentation. I'm always reminded, when we talk about patient safety or human error, I remember about a decade ago, there's a stat, I'm not sure how accurate it was, that 1 million pieces of luggage were lost by airlines every year. But since that time, with improved systems, they've reduced that by 70% or whatever the actual number was. Anywho, closely related to patient safety in our eyes is health literacy. Health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. I think we all know the importance of health literacy, but what significance does it hold for an organization, and what are the tangible benefits? At the end of 2017, we heard from Chris Trudeau and Alison Caballero from the University of Arkansas for Medical Sciences Center for Health Literacy. And in their presentation, they discussed the need for health literacy and how to advocate for it in an organization. Early on in the presentation, Alison talks about how literacy skills, out of a list that also included age, income, race, and ethnicity and educational level, is the best predictor of health outcomes. And 75% of patients who reported being in poor health also tested as having low literacy. But despite many opportunities for intervention, such as with patient consent forms, this rate is still low, and many people are signing for treatments that they don't fully understand. In this next segment, Chris and Alison discuss how health literacy might be the most important thing to integrate into healthcare, how it serves as both a sword and shield for healthcare organizations. And this may be of interest to those of you who are constantly trying to advocate for your services or literacy and patient empowerment. Something that I really liked in this video is at the beginning of the presentation, Chris said something along the lines of that if, give them a good team that has a clinician and a medical librarian, and you can change the world. Debbie?
Yeah, so this piece is interesting to me because it is like a legal perspective on why health literacy is important, which I think is a different viewpoint than we're normally used to seeing. And also an important point the speaker makes is that there are many problems in the system that all boil down to poor health literacy. And a lot of those problems affect many of us. Simple things like navigating our health insurance is one example. And also, the typical consent form or contract these days is really unreadable for any level of reader, and this affects many areas of our lives, like rental agreements, going to the hospital, or even just downloading an app, the consent user agreements for those. And so one thing they emphasized during this session is we need clearer and more reasonable communication in many areas. And so the connection I made here for librarians is that an often overlooked but valuable resource is information sharing and having availability of resources that are at a readable level. And so we can listen in for more detail on that.
Yeah, so however, I think we're getting closer to more tangible activities that you might all be doing or contributing to your organizations in terms of health literacy. So aside from the question that we have posted here, we'd love to hear we'd love to hear about what you've all been doing. Okay, here we go.
That we all tend to think about.
Great. So I just put in the chat box, last month, Chris published an informed consent research with some co-authors at UAMS and introduced a template that might be of interest to people. I'm operating from a mobile device right now, so I can't copy and paste the link without leaving the session. But that's something you might be interested in looking up and keeping handy. Okay, so Alice and Chris, you know, they talked a little bit about how healthcare systems are increasingly moving toward focusing on patient experiences. And about a year and a half ago, or maybe less than a year and a half ago, Lisa, our executive director, she attended the Healthcare and Information Management Systems Society HIMSS and attended the presentation that she really enjoyed by Shannon Wendling, the Associate Vice President of Informatics at Geisinger Health System in Pennsylvania. So she also served as a speaker for SCR CONNECTions for us, and we're going to look at, we're going to take a more granular examination of what it means to really tailor towards patient experiences. During her presentation, she talked about how they targeted specific patients and really thought through how to respond to their needs in clinical care. So if you're involved in any sort of design work, you know, focusing on the client, focusing on the patient, focusing on whatever has been the trend over for many past years now. And so as people are dealing with a lot of stressors and other concerns, as has been mentioned before, at least personally in my mind, it's important to learn how to engage and respond to their needs even more than the usual. And what this health system and others do is they go beyond the clinic to figure out how they can sustain interventions with outside farmers, such as you'll hear, prescribing food to families that live in food insecure areas. And I like this segment in particular because I think it really speaks to innovative collaborations and partnerships, and I hope it all helps you think about new or existing programs and the ways you can think about tailoring them towards your various audiences. Debbie?
Mm-hmm. Yes, and so I was thinking about, you know, with the patient experience, something I've heard a lot from health practitioners and also patients alike is that patients are dealing with a lot of real-life situations on top of whatever health issues they're dealing with that are not necessarily taken into the equation that can really affect their experience in their lives. And so I was thinking, again, from the perspective of librarianship, how can we support patients who are really all of us? I mean, we're you know, all essentially patients who make up this group. And again, it's by providing access to health information or resources that are easy to read so that patients have something that they can lean on for understanding, because in many cases, you know, people might be afraid to ask their doctor, or they may not understand what their doctor is saying, but maybe they can read something that is on an easy reading level that will help them understand and get through the scary parts of what it's like to be a patient and have to go through those different things. And so be thinking about, you know, where else can libraries or health educators come into this? How can we help?
I also went to HIMSS this past year in Vegas in February, and something I noticed is there was a lot of discussion about what you'll hear about now, but there wasn't necessarily a lot of people talking about health literacy. I'm not sure I even heard the phrase health literacy or health education come up too much, at least not at a granular level. So I think this is a great opportunity as you're listening to let us know how you think health information professionals can better support these efforts, and also what's missing from this discussion. Okay, let's hear it. Okay, so all of our presentations so far have touched on patient experience or informed consent or the importance of clear communication and sort of the relationship between all of these different concepts. In June 2016, Jeff Carlton, the Director of Media Relations at here at the University of North Texas Health Science Center, where we work, gave a talk on how to pitch stories to the press. Hopefully it's not clear why we decided to close with this segment on how to tell stories, because even though the majority of us don't talk directly to the press, it's always important to be able to communicate, what we're doing and why we're doing to our patrons, patients, clients, administrators, or other stakeholders. Assuming you've now, with all this great information, put together a great customized program for your audiences. The lessons that Jeff talks about are great for outreach, education, and engagement activities. I used to run actually a lot of storytelling workshops when I lived in Ohio, and we especially got a lot of librarians, medical librarians as well, pre-med, med faculty who are really interested in how do we better reach people, whether it's our students or our patients. One of these lessons is that our audience, like reporters, are not going to remember, an hour of lecture or a lot of content crammed onto a page. Just 2 to 3 key messages that you can repeat and emphasize. This final segment is the shortest, but I think it has some great tips that I think can be implemented right away. And again, please continue to write down your thoughts or sort of closing thoughts as we finish with this last segment. Debbie?
Yeah, so listening to Jeff's section, pitching a story, he does mention speaking with reporters, but although we might not actually work with reporters, I was thinking about, how we want to get our library story out, stories or events. We want to tell people, our patrons, about our programs or events we're having within the community, and that's definitely a form of communication and also promotion, just perhaps from a different viewpoint. And so some of the key aspects that Jeff talks about can be gleaned, like using brief messages, thinking about your audience. So just keep an eye out for how his tips can translate to your own organization's ability to get your own story out.
Yeah, and then in addition to that, our final question here: how have you successfully communicated your achievements, or what do you want to learn to better promote or report what you've been doing? Oops. So I think I accidentally included a little bit too much of the segment. It went over a little bit. Apologies for that. But I really like that. I really like that presentation. Again, you know, most of us do not talk to the press, but I think a lot of the tips are still applicable. And we all know we're all bombarded with information as professionals, in our personal lives, or as patients, or faculty members, or whatever role you play in your institution. So learning how to break through the noise to communicate to whoever you're trying to communicate to is important. I know I constantly work on that. Anyone who's received an email from me, and I recognize quite a few of the names here, know that I'm not always great at reining it in, but I try. Anyways, you know, thank you for joining us today. We encourage you all to watch the full versions of these presentations if you found them compelling, if you get a chance. Otherwise, we'd love to open it up now to any questions or comments that you might have, and I'll scan through the chat box for your comments. I see here someone wrote, in my past life as a newspaper editor and page designer, I always appreciated receiving contact information for someone who would actually be willing to talk in person and had other contacts for me in mind. I know that's something we're always trying to do is connect people to other people that we might know whenever it comes up in conversation. I also see that as really a value-added service as well.
And also, I'd just like to throw in, too, there's a resource, Health Reach, that has health information in multiple languages, and so I think that is something that people are starting to see as important. So definitely, I think that's a great idea.
Okay, another comment here at the border metroplex of El Paso, Texas, Juarez, Mexico, and Southeast New Mexico. We have multiple native languages. I like to translate all materials using computer translation systems. How do you feel about broadcasting information, stories, articles, etc., globally using translation systems? Oh,
Brian, that was one I was referring to. Sorry, I should have stated the comment first, but yeah, yeah.
And then, yeah, Sarah has posted the link to our archive webinars. All of our webinars are archived.
And that is a good question, Molly, I think, is how do you get things to third grade reading level in other languages, too? I think that's something that can definitely be worked on as well. So if we have any more questions, we'll take them right now, and but we'll be wrapping up soon because we have a few housekeeping items at the end that Sarah will need to get to. So we'll just take a couple last ones, and then we'll have to wrap it up.
This comment again here, people tend to send inadequate information. Debbie knows in particular that I'll often have her look at things that I've written because I'm not always sure if I'm getting my point across well. So having peers who can help you look through your communication as well if you don't have particular expertise.
All right, thank you everyone so much for your questions. We're going to go ahead and stop the recording so that we can get to our final housekeeping items. And thank you so much, Brian, for doing the hosting for this session and curating all of those previous webinars for us.